Hello, my name is Dr. Randy Reed, and I want to welcome you to this presentation today on behalf of Better Doctor Seminars. The literature published on the topic of decompression frequently doesn't clearly explain to us just how the decompression was applied and for how long the decompression was applied. It doesn't ever tell us how frequently the decompression was applied, 2 days apart, 3 days a week, 4 days a week. It doesn't usually say that. So we have to look at that a little deeper. So when we were trying to put our programs together for our offices, we ended up with a kind of a, I take one from here and take one from there and take one from there. Now, I want to make you understand one single thing on this presentation. I am no better than any of you that are watching this presentation. I am not any better clinician. I am not any better anything. I have not ever had, or nor will have, I don't think, an original thought as to how to do things. Everything I'm talking to you today is bits and pieces from different experts. People that are much smarter than me, much greater than me, and understand things a lot greater than me. But I do think that you must take the best from the best, put them together for you, and build the system for you that works the best in your particular type of practice. In my chiropractic practice, we're going to show you how we do decompression and how it works for us and how we've taken the research and built a great decompression practice. When we look at this, this is a GOSE study, G-O-S-E, which also was in the Journal of Neurological Research in 1998. What he did was he took decompression patients for patients with diagnosis of three things: herniated discs, degenerative discs, or patients with facet syndromes. He took, at 20-some hospitals, 778 cases. There were 778 people. The average time between the initial onset of symptoms and the beginning of this treatment was 40 months. Let me say that again. The average time from the time this treatment started to when the patient's symptoms started was 40 months. Over 3 years. These patients had had pain for over 3 years in this study. The average of that was. The data was collected from 22 medical centers in the United States. The average number of treatments was 17 for the facet people, 19 for the degeneration people, and 20 for the herniated disc patients. We talked about if there's some compressive force or there's some buckling by the annulus, when the annulus buckles, we will create a discal force on that nucleus and cause that nucleus to go somewhere. It will bust through. It'll cause a tear. It'll go through an end plate. Look how the end plate has risen up in all of this section here. That is soft cartilaginous end plate, and that just didn't happen overnight. That pressure has been pushing up on that end plate for quite a long time. Okay? On this side, we can see the annuluses, the annulus fibrosus in this nice little cartilaginous thing with all these little lines doing okay. But if you look at the posterior part, look at the shape of the annulus and how the annulus has buckled. Look at the difference between the shape on the right and the shape on the left. Nice and long and tall over here on the left. Buckled and bent, almost folded over on this side. Now there is no posterior bulging too much in the back of this disc as we look at this back through here, but we do have nuclear shift as the nucleus is starting to shift in this direction.